My journey or experience with chronic pain goes back many years, nearly 40 years, and it's the result of a near fatal car accident I had when I was 16. So I have what's called neuropathic pain. My pain would range anywhere from like a 7 to a 9. You get up in the morning after a terrible night's sleep, your feet hit the floor, it's ow, how do I get through this again? Like, how do I just get up and go to the shower? Because for me, a shower, the water running down my side hurts. So you never get to escape it. I didn't live well with it at all. I didn't understand it. I fought it a lot. I had many surgeries, I had many interventions, but none of it took the pain away, and I just thought nobody was trying hard enough. At one time I was told by my family physician that it was all in my head. I was having some nerve blocks, and they're called paravertebral nerve blocks. The doctor said, look, these aren't very effective. You've now suffered a lung collapse. I don't think we should be doing this anymore. There's this thing being done at St. Paul's called spinal cord intervention. You might want to look at that. I'm sitting there not even looking at the doctor. He's asking questions. I'm just answering. At one point, he just stopped talking to me. And I thought, well, here we go again. I'm going to be told that you're not a candidate, or it's all in your head, or this isn't the right therapy. And I was almost ready to just get up and leave. I kind of looked over at him, and I thought, well, here it comes. And he'd put his pen down, and he looked at me with the most compassion I had ever received by that point in my life from a physician. And he said, it's okay, we believe you. And that moment of validation was transformative in that I didn't jump up and do handsprings and go, I'm cured, but it cracked the door open just enough for me to go, somebody actually believes me. Dr. Varshney's approach is one of true patient-centered or patient-focused care. All my interactions with him are on a much more personal level, and that just really humanizes that relationship between the doctor and the patient.
Pain is a very personal experience for people. It affects them in various ways. And one of the things that I always ask all my patients is, what are you not able to do now that you would like to be able to do? And what are your goals overall? Our goal is to be able to get people back to being functional, back to being able to do the things that they want to do, the things that they find joy in doing. And that framework, that kind of vision overall is what guides a lot of the treatments and therapies that we want to be able to offer. And we can see a couple of incisions here. So this is where his battery is located, and these are where the incisions are. The electrodes are attached to this battery and just under the skin.
After the stimulator, it probably knocked it down by like 30 to maybe 40%. And it took that sharpness and it just kind of rounded the sharp edges off, and it would give me some space to get away from my pain, and I could then focus on life, because most of my energy was focused on how do I get through every single day, just taking the small victories, sometimes almost hour by hour or day by day, and feel that you can have a little bit better life living with pain, and that can grow and grow. It's something you have to live with, but it isn't who you are.